Often when we think about health literacy, we sort of talk about this idea that it's about what the patient should do. So if the patient could read better, if the patient could understand information. But what we know about health literacy is that it's really twofold. It's not just about what the patient needs to do, but it's also about what that provider or that practice or that setting can also do to aid that patient in their ability to be health literate. Sort of the three things that most patients want to know. They want to know, what's the problem? How can I fix it? And why is it important for me to do what you want me to do? And so generally, if you can attack those three, patients will often, they get it. So what's some good advice? One is to limit instructions to 3 or 4 major points. Then after that, people start to just, maybe it might be the last ones in or the ones I remember and the stuff you told me at the beginning, not so much. And a lot of times when we're delivering information, it's the stuff at the beginning that's most important because what we're telling them is cumulative. So you've got to understand points 1 and 2 before you can understand 3 and 4. Well, if that's the case, don't give people 10 points at a time. Repeat, repeat, repeat again. So again, this idea of, okay, I've given you this information, now come back to me and tell me exactly, what you said, and continue. So be prepared that that's the cycle and you're going to be living in that cycle, but it's really to make sure that people understand what you're saying to them. Using simple everyday language. So this is not those of us who work in healthcare, we work in jargon. We live in jargon. Lay folks don't live in jargon, especially at the beginning of their experience. So use this as a way to teach them in everyday language what it is that you want them to do. And again, using this idea of using written information or pamphlets and verbal education at all encounters. So I'm giving you something in writing, but I'm explaining to you what this is. I'm asking you to tell me what it is that that I just said to you, and then here's something written that you can take home with you that reaffirms everything that we just talked about. So if you're in the position of being able to design your own material, which is awesome, it's important to remember a few things. So one is that someone's reading level is not the same as their health literacy level. So we know that people tend to read about 3 to 5 grades below their last year of educational attainment. In addition, we know that your ability to read words and having written fluency is not equal to actual understanding of those words. So I might be able to read the word colonoscopy, but if you were to say to me, what is a colonoscopy? Well, I don't actually know what a colonoscopy is. I just know that that word says colonoscopy. Here are just some resources here. Simply put is a great way if you're actually in the position to be designing your own stuff. The plain language thesaurus, so if you are writing things, how to actually, create your own. Every interaction with the patient is an opportunity to use health literacy skills, and hopefully you understand why they will be better for it.